Let's talk about how you can save some money during Medicare Annual Enrollment. Medicare Annual Enrollment is the period every year from October 15th to December 7th where you can assess your health needs and decide if you want to switch Medicare plans. This is a great time to look through all your Medicare plans and see if there's some money to be saved going into the next year. Now, we have thousands of clients and we have helped thousands of people get the lowest possible cost for their Medicare needs, and today we're going to pull back the curtain and show you how we do it. So let's dive into it. The first thing that we do is educate people on how Medicare works. Now, this might sound basic, but you would be shocked at the amount of people that are coming into our office and think they're getting a great deal, and really they're overpaying by thousands upon thousands of dollars a year. When most people first sign up for Medicare, they simply do what a friend or neighbor suggests or take the advice of a stranger on a phone. Most people don't know what they're signing up for and simply say, yeah, that seems about what it should cost, and move on for years at a time. Most people have no education on how Medicare really works, and they don't truly know what their options are. Now, we get it. There are deductibles and donut holes and preferred pharmacies and co-insurances and Medicare excess and all these crazy things that make it feel overwhelming to truly understand Medicare. So we always start with basics with our current and new clients and go through the intricacies of Medicare Part D, Medicare Advantage plans, and Medicare supplements so people truly understand what they are signing up for. It may seem confusing at first, but with about 10 or 20 minutes of concise education, we can cut through all the crap and you can understand how Medicare is working for you. You'll learn that you might be paying more for your drugs because you're going to the wrong pharmacy on your plan. You'll learn that there may be Medicare Advantage plans out there that have lower specialist copays. You'll learn that maybe one of your doctors left the Medicare Advantage network and that's leading to higher copays and co-insurances for the services. You might learn that there's a plan out there that has a much lower premium for your drugs. There are many avenues for you to save money on your Medicare, and it all starts with you fully understanding how Medicare works. The second thing we do is reassess your drug costs. The most variable cost within Medicare is often prescription drugs. Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage have a very confusing payment structure. It's kind of like a roller coaster, and this can leave people overwhelmed with how to understand their drug plans. But don't fret, because every year you are given the chance to switch drug plans going into the next calendar year and to save some money. The first thing we do is compare your current plan with every other plan available in your area for the upcoming year. We're going to compare the drug plan premiums, we're going to compare your drug copays, and we're going to see if there's any other pharmacies that you'd prefer to go to. With this holistic view, we're able to look at every variable in the cost of your drugs and see if there's a plan that over the course of the year has a lower cost compared to what you are currently paying. We check to see if you can get a lower monthly premium, we check to see if you can get lower drug copays, and we check services like GoodRx to see if you can get lower copays with GoodRx or SingleCare. Many people just take a name brand prescription plan when they first go onto Medicare and say, yeah, that's about what it should cost. And they could be paying $70, $80, $90, $100, $120 a month in premiums when they're on one cholesterol medicine or one high blood pressure medicine. In most cases, you are overpaying if you have such a high premium, and it's always worth it to double check and see if there's something that can reduce your costs in a big way. The next thing we do is look at any changes that could be happening to your Medicare prescription drug plans or Medicare Advantage plans. Oftentimes, people don't want to deal with Medicare or health insurance in general, and we get it, it can be very boring, but ignorance can lead to some huge unexpected costs if you don't pay attention. Every year, your Medicare Advantage plan or your Medicare Prescription Drug Plan is going to send you a huge packet that is going to detail any changes to the plan. This could lead to increased premiums, it could lead to increased specialist copays or co-insurances for services with the Medicare Advantage plan, it could lead to increased drug copays, it could lead to an increase or decrease in benefits. And in this booklet, it's not uncommon for monthly premiums to raise $20, $30, $40, $50, $60, maybe even more going into the next year. It's not uncommon for doctors to leave a network. It's not uncommon for pharmacies to change and leave certain plans. A bunch of different things can happen, and if you don't stay on top of this, you could see your costs rise in a big way. If you have professionals in your corner looking out for all these changes, you will never have to worry about any big surprises. And if for whatever reason the changes are too dramatic, we can always look at other options for you and switch plans before it's too late and you're stuck with a plan for an entire year. The next thing we do is check any new plans or products that are entering the market. Every year, insurance carriers add new Medicare products to the market, or insurance carriers that don't have any Medicare products decide that they're going to try to get in on the action. When this happens, insurance carriers usually undercut the market or offer huge benefits to people in order to get new customers. This can lead to huge savings and other benefits if you know where to go. We are monitoring Medicare and insurance carriers all day, every day, and if there's savings to be had for our new and current clients, we are always going to find them. Medicare Annual Enrollment is a great way to see if there's a new kid on the block that is trying to pass on savings to you. The last thing we do is reassess your Medicare supplement. Just about every year, your monthly premiums for your Medicare supplement are going to go up. And different insurance carriers are going to raise their monthly premiums at different rates. By the time you're in your late 60s or 70s, you could be paying monthly premiums that are way above market value. When you have a Plan G or a Plan F or a Plan N, the insurance carrier doesn't matter. These Plan Gs and Plan Ns and Plan Fs are made by the federal government, and the insurance carriers have to give you the same exact service, the same exact network. Everything has to be identical due to federal law. So you don't have to pay a premium for a brand name insurance carrier. A Plan G from a well-known brand is just as good as one from a non-well-known brand. You do have to answer health questions to switch between insurance carriers, but this is a chance to save a huge amount of money. We have seen people save $30 or $70 a month, which is hundreds of dollars a year, by switching between insurance carriers but keeping the same Plan G, keeping the same Plan F, or keeping the same Plan N. You can also move down between Medicare supplements. For instance, a Plan F is almost in every case more expensive than a Plan G, even when you account for the $226 deductible that is going to be happening in 2023. Moving from a Plan F to a Plan G is a great way to lower your monthly costs and your overall costs for the entire year. Now, if you want to work with a professional this year, reach out to the trusted brokers at NJ Life and Health. We have helped thousands of people get their Medicare costs lower over the years, and chances are we can do the same for you. Reach out to our office at 848-226-6897 to schedule an appointment in person, on Zoom, or via phone. We also do house calls, and you can also visit our website at www.njlifeandhealth.com. Or if you're in the Ocean County area, you can stop by our office at 600 Mule Road, Unit 10, Toms River, New Jersey, 08757. Our appointments are booking up fast for this year, so be sure to reach out before we are fully booked. Thanks, and if you have any further questions, feel free to reach out to us. Like, comment, subscribe, share this with somebody who needs to see it.